So good morning everybody. Hello. So today we will be dealing with the anti-helmintic drugs. So these are against the drugs against this, the infesting the human body. These are the parasites. So compared to the other group of drugs still now in antimicrobial classes, okay, these drugs are having better compliance because these drugs are one-shot drugs. Like, have you heard of drug? Single dose liquid preparations? Yes or no? Drug, the term you have heard. Albendazole, single dose liquid preparation. Yes? Okay. So here the common problems what we come across is drug resistance, dosage compliance, and toxicity, drug interactions, all these things will be there. Here dosage compliance can be very much assured because single dose treatments are available. Then resistance. Okay, here in most of the anti-helmintic group, the resistance is not a common feature. Okay, we do not discuss about that. That means even after prolonged administration, there is very less chances of resistance. Okay, so the negative point here are the parasites can be paralyzed. Most of the drugs here are acting on the GABA-gated chloride channels and all. So they can cause some neuromuscular toxicities also. Okay, so along with that, if the parasite is killed or it is rendered paralyzed, what can happen? There can be toxic substances released from the parasite itself. So after the drug treatment, we need to be careful about the allergic reaction, and the worms may be so much so infested that we need to use a purgative agent to clear the bowel. Okay, with all this knowledge, and we have studied that in the last class, the most of the infection in amoeba, we told the fecal-oral group. Okay, here fecal-oral group can also be shown, and barefooted walking. Okay, so the drugs in this antihelmintics are to treat the parasitic worm infections. Okay, unlike protozoa, they are large and complex cellular structures. Okay, and drug treatment is most of the time specific. But thanks to the drugs, where there are classical drugs such as albendazole and prazipentol, they will be active against most of the worms in those groups. So it is very important to identify the positive organism. We identify this positive organism by stool microscopic examination. We examine the stool and we find the ova and cyst, and we can classify the agent. So it can also be done by urine, blood, sputum, and tissue examination. So helminths, we can classify them as nematodes, nemathelminths, that is roundworm, platyhelminths, that is the worms are flat, okay, and these are flukes, and we have cestodes. Okay, cestodes are the tapeworms. They are like tape. So nematodes, we have roundworm, hookworm, whipworm. Okay, in most of these cases, they form worm ball-like condition after chronic disease, and the baby will be malnourished with features of malnourished, and there will not be absolute features of kwashiorkor, but there will be pot belly type. Okay, we can think of this condition. The signs of malnourishment is there, but the tummy is bulky. Okay, so then threadworm, pinworm, enterobius vermicularis, the difficult disease for the treatment, because here the treatment will go for months together. Filariasis, which is a branch of the again, this is one of the conditions where the treatment will be prolonged. Elephantiasis, have you heard of it? That is filariasis. Okay, onchocerciasis by Onchocerciasis volvulus. Okay, this is eye infection. Then guinea worm infection, dracunculosis. This guinea worm is with the help of our national programs, it is almost eradicated disease, but still we need to know the drugs used for it. Trematodes, we have blood flukes, liver flukes, intestinal flukes. In cestodes, we have the beak tapeworm, boat tapeworm, fish tapeworm. Okay, these are the agents which will be naturally going into the inhabiting the intestinal or the lungs or the body cavities of this major animals. Okay, pork, beef, fish, we can identify those, I think. Then the dog tapeworm, that is Hymenolithus now. So if we are consuming these products, the animal products, and the person who is preparing it may not have sterilized it, or the proper measures have not been taken, so that the cooking procedures are not followed up to the mark, you can always get the cysts into your stomach, and thereby they can multiply. So here the first step you can see, it penetrates the skin on the left hand side. So it is most commonly open plate defecation, barefooted. Okay, so once the person is going barefooted, what can happen in the open fields? There can be penetration of the skin by this filariform larvae. Okay, and they can enter the skin and enter the circulation. After the circulation, they can enter into the lungs, trachea, pharynx. Okay, from there they can enter the GI tract. Okay, they can be swallowed. Okay, adult worms are swallowed. They inhabit the intestinal walls. So, and there they can multiply and eggs are released. Okay, this eggs again they can convert in the body. They can go through this same cycle, and filariform larvae can enter the circulation. There, after defecation, into the external environment, they can get converted into living adults. Okay, so eggs in the soil, they can also be ingested by the animals, and they can be lodged on the vegetables. Okay, vegetables in the pits. If you are not washing thoroughly, then also you can get this diseases. So classification of drugs used here. Drugs used against nematodes, we have albendazole, mebendazole, parental formoid, levamisole. Okay, albendazole, mebendazole, it sounds similar to our metronidazole. Okay, so these are again imidazole derivatives. Then levamisole is an important drug. You can be very short notes. Okay, it's an immunomodulator, antihelmintic drug used in most of the conditions of skin. Piperazine, okay, piperazine, the drug which can cause paralysis. Okay, Ivermectin, the antiscabitic drug. Diethylcarbamazine, the drug of choice for filariasis. Albendazole and doxycycline. Doxycycline, I think all of you are familiar with this drug. Drugs against trematodes, we have metryphosphonates, okay, oxamniquine, bithionol, and triclabendazole. Against cestodes, we have Niclosamide, and against most of the trematodes and cestodes, Vesipental is effective. You can always have the slides. Okay, so drugs against nematodes, we have parental formoid. Okay, how does it act? Here, the mechanism of action is by blocking the acetylcholine at the neuromuscular junction, resulting in paralysis of the worms, and worms can be expelled out as feces. So, do you remember diethylcarbamazine furoate? Okay, here, there 90% was observed, only 10% was available for the luminal action. Here again, our parental formoid is a luminal parasiticide. Okay, it is a luminal antihelmintic Okay, whatever which is unobserved, okay, that will be acting as a cidal agent. It is used against roundworm, hookworm and pinworm. So it may cause the photosensitive reactions, neurological symptoms based on its action to acetylcholine release, okay, and can precipitate epilepsy. We have read about the nitroimidazoles. Today we are reading about the benzimidazoles. Okay, so albendazole and mebendazole. So albendazole 400 mg single dose is curable for most of the diseases only in early stages. Okay. So albendazole 400 mg overnight. Okay. Now syrups are available with 400 mg dosage. Most of the time, about 3 years we give full dosage. Okay. So here dose calculation problem is not there. Okay. In case of other drugs, we used to calculate. Okay, this is 10 mg per kg. How much it will be for the other options and like that. Here, a blanket dose more than 3 to 5 years, we can give the full dosage 400 mg overnight. And along with that, we usually administer a albumin. Here, this albendazole is involved in the breaking up of the energy synthesis mechanism by acting on the beta tubulins. Okay, so it binds to the beta tubulin, prevent the polymerization, breakdown of the cytoplasmic microtubules, thereby inhibit the uptake of the glucose and nutrients. So glycogen stores are depleted, ATP synthesis is decreased. Decrease in the ATP synthesis leading to autolysis and death of the parasite forms. So here you can see the agents which are causing. What is the second photo? Any guess? It is neurocysticercosis. Okay. So here you can see the small cyst. Okay. After dying, what we form, there will be allergic reaction to the cystic walls. Okay. That is causing problem, and once it goes on increasing, the allergic reaction and the coating around the cyst will go on increasing. What will happen? There will be compression of the brain structure, and wherever the cyst is there, the surrounding area function will be lost, whether it will be motor or a sensory part, anything. Okay, what are these balls? Have you seen it? Albendazole, mebendazole, these are the drugs used in headache cyst also. Okay, these are the headache cysts which can be obtained from the liver. Okay, and some of the parts. You can see glistening balls. Okay, so many things will be there. I'll be showing the CT scan the same. So mebendazole compared to albendazole, patient complaints will be less because this drug is given as a dose of 100 mg BD for 3 days. What the work can be done by single dose albendazole will be done with mebendazole at that dose. So, and compared to albendazole, mebendazole is less effective also. Albendazole is more effective. So, fatty meal can increase the absorption of both the drugs. Okay, if the urine is alkaline, the drug is eliminated slower. Okay, acidic urine, there can be faster elimination. So usually the DHAP is around 8 to 10 hours. Here the dosage for threadworm is single dose, then 2 times daily for hookworm and roundworm infestation. So as the drug is eliminated by renal route, by urine, in case of nephrotoxic diseases or the patient is already compromised with renal function, we may not use this drug. So uses of this albendazole, the prototype drug, or the benzimidazoles. Here we can use it for ascariasis, hookworm, pinworm infection, hydatid disease. We are seeing those hydatid glistening cysts. Okay, those cyst elimination, we need to give this drug 2 times daily for 1 month. So, knowing the mechanism of action, like blocking the beta tubulins and we can inhibit the ATP synthesis and all, what will be the toxicity levels. So, such studies were done. After 6 months, if the patient has taken, then also the toxicity levels were minimum. Okay, that means it's a better tolerated drug compared to parental formulate. Okay. Then we can use this drug for neurocystic psychosis. Neurocystic psychosis, I told the drug actually may not be able to cure the problem because here the problem is mainly due to the cyst wall allergic reaction or the toxic cycle which has happened there. Once the cyst has gone there and the cyst has died there, and around that cyst there is the allergic reaction of the protective coating layer which is going on increasing. So in these cases we need to administer corticosteroids. Corticosteroids forms the main line of treatment here, but along with that this can be helpful. So we can use it in cutaneous larval migrans, 400 mg for 3 days, visceral larval migrans, toxocariasis, giardiasis, okay, R is missing there, so then empirical treatment for persistent eosinophilia. So eosinophils, these are the blood cells which will be increased with any foreign body, any allergic reactions, okay, the patient is chronic rhinitis and all these conditions where allergic symptoms are there. Okay, presence of any small foreign body itself can cause so many allergic reactions, but in case of this worms, there can be lot of allergic reactions. Okay, that's why the eosinophils will keep on mounting. Okay, that is one more indication for us to use give a try for this anti-helmintic drugs. So empirical treatment of persistent eosinophilia, we give this drug. So what are the adverse reactions we can expect here? Okay. So it is well tolerated, but still there can be epigastric distress, alopecia, insomnia, and it is found to be teratogenic. Thiabendazole, again it inhibits the cellular enzymes of susceptible helminths. So side effects are in the form of gastrointestinal, neurological, and hypersensitivity reactions. Higher of this crystalluria in sulfonamides. Okay, so thiabendazole can cause this crystalluria. So how do you prevent this crystalluria? Adequate water. See, diagram what you are seeing, these are the or the old deposits on the forms. Okay, so if you are walking barefooted, you can get these lodged in your skin. So Levamisole, okay, Levamisole is the antihelmintic immunomodulator drug and belongs to the class of imidazole, thiazole. So we are using it for round-worm infection, skin diseases, lichen planus, so many conditions we are using this drug. Here its mechanism of action is by nicotine-like action, acts on the neuromuscular junction, and paralyzed neurons are expelled in the fetus. Levamisole we have tried it in lichen planus and also in chronic aphthous ulcers. Okay, chronic aphthous ulcers, it may be due to the worm infestation or sometimes immune mediated also. So in both these cases, Levamisole will be helpful. Here Levamisole can be used in leprosy, warts. Warts are caused by warts are viral infections. Okay. Lichen planus, have you seen lichen planus? Flat top lesions all over the body. Okay. Sudden onset, usually due to the reaction to some drugs. After census, in all these conditions, we are using it. Okay, side effects, gastrointestinal disturbances, and the drugs which are acting on this neuromuscular junctions or the nicotinic or the acetylcholine side, so they can be toxic to the mammalian host. Okay, if high concentration can be achieved at the site, they can be toxic. Piperazine, you remember, P for P, paralysis. Okay, piperazine can cause paralysis of these worms, and it should not be used with parental pomoate. Okay, 2 P's you need to remember with this parental pomoate, piperazine. It again acts by inhibition of the neuromuscular transmission of the worms. Okay, thereby by acting on this GABA-gated chloride channel. See, these particular GABA-gated chloride channel are particular to this worms. Okay, and similar type of channels will not be there. Okay, so they will be selective to the organisms, and this paralyzed worms can be expelled alive. Pinworm infection or the centrobius, this will be very difficult to treat. Most of the time, the treatment will last long for 1 month. Okay, here with piperazine, you can use it for 4 grams for 7 days. The per kg body weight dose is very much higher. Okay, almost 2 to 350 milligram per kg. We are administering it. Okay, it can be used for ascariasis and pinworm infection. So, and adverse effects, remember, most of these drugs are having this allergic reactions, and the nitrosamine metabolite of this piperazine can be carcinogenic and teratogenic. So Ivermectin, here it is used as an antihelmintic agent, but it is also a drug for the drug of choice for scabies. Okay, it is highly effective drug and a broad spectrum anti-parasitic drug, and is also used for the filarial infection and orthoceriasis. Filariasis, the drug of choice is diethylcarbamazine, but this drug is also effective. Here you can see again the action is by glutamate-gated chloride channels. Again, this is a specific channel available in the worms. Okay, not found in humans. So here it can increase the acetylcholine levels, leading to motor paralysis, and it can also bind to this aminobutyric acid receptors. So the final action will be acting on this nicotinic receptor. See, the hand picture what you are seeing is of scabies. Okay, it involves the intertriginal areas. Ivermectin, we give it at the dose of blanket dosage here again, below 5 years, or there we use it at 150 micrograms, but below above 10 to 12 years we use a blanket dose of 12 milligram. Okay, that dose is not given correctly in Sharma, just corrected. Okay, so 12 milligram single dose. acid, that is to kill this Piperazine bankruptcy, which can cause this elephantiasis. Onchocerciasis, it is also called as river blindness. Okay, so a single dose can kill this microfilaria of this Onchocerciasis volvulus. Okay, and it also has action on this roundworm, whipworm, and threadworm. Now we have a syrup single dose broad preparation where they combine the 6 mg of Ivermectin and 400 mg of albendazole. So adverse effects here are skin rashes, fever, giddiness, and pains in the muscles and joints. Diethylcarbamazine, the classical drug for this elephantiasis. Okay, so very few drugs have this 100 mg dosage. So diethylcarbamazine is one, doxycycline. Diethylcarbamazine again is a piperazine derivative active against this Piperazine bankruptcy, acts by opsonization of the worms. Okay, so once opsonization has occurred, the worms will be more detectable by our immune system. Okay, so that is one mechanism, and another mechanism is it can immobilize the microfilaria, alter their surface structure. Okay, once it is altering the surface structure, it will become more susceptible for the host defense. So again here excretion is by urinary method, and most of the drug is excreted unchanged and also by N-oxide metabolite. By using that, can we reverse this elephantic acid? It is not possible. Okay, but what can be done is we can give chemoprophylaxis in the areas where the disease is common. Okay, in the endemic areas we can give a chemoprophylaxis, thereby prevent the disease. But once the lymphatics is being infested, it is very difficult to treat. So filariasis, we give it at a dose of 2 to 3 mg per kg for 2 weeks. Topical eosinophobia, we are giving it at same dosage 2 to 3 mg per kg for 7 days. The adverse effects are, as it is a oral administered drug, fever, headache, anorexia, all these things are seen. Okay. Then urticaria and asthmatic attack can occur after first dose of the drug. So we are here the dosage increase slowly. For example, the maximum dosage we give is 100 mg. So we can start giving that 25 mg, then raise it to 50, then to 100. Is there any drug where we start with higher dose, then reduce the dose? Usually corticosteroids. Okay, corticosteroids are started with full high dose, then taper down. So diethylcarbamazine started with low dose, raised to highest. So that's again cystole, Niclosamide. Okay. See what happens is the primary part which attaches to the intestinal wall is this scolex, okay, and the primary segment. And by the action of this drug, what happens? Inhibits the parasite mitochondrial anaerobic phosphorylation of ADP. That usable energy is not there, so it can get detached from the intestinal surface. Once it is intestinal separated, okay, it can be better. Here you can see it is negligible absorption in the GI tract. That means the drug, if it is available on the intestinal lumen, that will be effective. So used for tinea solia as a single dose and forget use after 2 hours. Here you can see the life cycle of the fish tapeworm. Okay, so adverse effects of this Niclosamide is unwanted effects are very few. It can cause drowsiness, dizziness, anorexia, and is contraindicated in pregnant women. So albendazole, levamisole, most of these drugs are contraindicated in pregnancy. Sometimes albendazole is tried, but most of these drugs are acting on this neuromuscular junction, globulated channels and all. So better they are avoided. So drug interactions, enzyme inducers such as phentoin, carbamazepine, they can increase the metabolism. Cimetidine, as we know, it is a enzyme inhibitor, can decrease its metabolism. Precipintal drug against both tramadol and cystose. Most of this tramadol cystose, they are susceptible to this drug